The effects of the seasons are easily seen, yet understanding the root of your symptoms are often screened. How might you identify your symptoms of trauma? I use the lesson I call Tap Your SOS Symptoms of Trauma. This video introduces you to the second of what I call Trial Action Paths, or TAPS. SOS is a wordplay on the radio call sign for help or distress. SOS represents the reason you might be watching this video, reading my books, or why you might be considering going to therapy. You might need help, or you might know someone who is crying for help. When I went to therapy, I identified a major problem that was deeply painful: my brother's suicide. I needed to talk to someone about this problem because of the internal symptoms I was experiencing in my life. My family and friends saw my obvious symptoms. I knew I wanted to address the underlying issue of grief and pain and regret that was causing physical manifestations of anger, sleeplessness, and irritability. This is not therapy, but educational tips. I needed therapy after my brother's suicide, and you might need assistance with your trial of trauma. When my clients show up needing help for a reason that is unknown to me, I will often ask questions like, why are you here today? What problem brought you today? How can I help you? Then I listen to the initial identified problem, yet few clients begin explaining the root or real problem. Instead, they disclose general symptoms such as stress, anxiety, depression, addictions, or other harmful behaviors. These are often observable symptoms that they notice about themselves or that others have identified as a problem, such as being able to keep a job, stay in a relationship, and there are sometimes family or the legal system will point out some other harmful behaviors such as addictions or arrests. It is important to determine the root problem, not just treat the symptom. Having typical reactions to trials and traumas is not a sign of weakness, but when these reactions become harmful to yourself or others, you know you need help. When your reactions impair your ability to perform normal daily activities and responsibilities or endanger yourself or others, you need to seek professional help. If you realize you need help from a professional, only focusing on the symptoms and how to stop them will waste your time and money. You could spend weeks, months, years in therapy discussing symptoms without discovering the root problem. With the passing of time, those symptoms may lessen, and you and your therapist may conclude that therapy is no longer needed. If you are really concentrating on the root problem, a few weeks or months of therapy might be sufficient. However, only focusing on symptoms is probably a waste of time. Just understand that the therapist can only work with what you tell them. If we're just meeting for the first time, I'm Hugh Watt, founder and author of Trial Tappers. Who are Trial Tappers? People that find hope, resilience, and post-traumatic growth after life's trials and traumas. Our motto is, we tap pain, we find a path, and we grow stronger. Consider the seasons during a year and how they affect a tree. During the spring, the fresh green leaves bud out to the branches. As spring turns to summer, the leaves turn to dark green and begin to develop seed pods. As summer turns to fall, the leaves begin to turn red and orange and yellow. Then as the fall turns to winter, the leaves lose their bright colors and fade to brown and eventually die and fall to the ground. The signs and stages of the leaf of the maple tree are predictable and progress with the passing of time. Weather is the main cause of these changes. When the weather warms, it signals the roots to begin producing sap. When the weather cools, it signals the tree to stop producing sap and the leaves begin to die. Here's a cutout piece of tree with 4 different leaves. Each ring identifies a year and the health of it during its lifetime. Just like the health of the tree cannot be identified until you look inside, you also need to look inside to see where your trauma lies. Don't be fooled into thinking that you've resolved some past trauma. As the seasons cycle throughout the year, a tree will eventually end up dormant, not showing any signs of life. Your signs and symptoms can eventually go back into hibernation until you experience a similar trauma or even the same season during the year. Why would your symptoms appear to be gone for a season and then reappear? If you don't truly address the root cause, they could come back because you have avoided the real problem and chosen not to address them. You might have buried the problem deep inside and avoided or replaced the problem with other behaviors or habits, or even worse, covered them up by abusing substances. It is not uncommon for unwanted symptoms or physical reactions to intensify during the actual season of the year when that big trial or trauma occurred. Which season causes you the most trouble will depend on your life's experiences. The loss of a family member could make the winter or holidays difficult. A past traumatic abuse that occurred in the summer may cause reoccurring nightmares each July. Many people who suffer with depression have difficulty in the winter. However, although the holidays can be difficult for many who have experienced a trial or trauma, I'm always concerned about their actions during the fall and spring. According to the Center for Disease Control, CDC, suicide rates spike in the spring and fall, not around the holidays as many expect. Experiencing some seasonal symptoms is typical on anniversaries of your past trials, as you may never forget some of the worst events. If the symptoms cause increasing discomfort, perhaps you have a root problem that needs to be investigated with the assistance of a professional therapist. The first step is to realize that you need assistance dealing with the unwanted symptoms. Family or friends may point out your repeated behaviors, your moods, or signs and symptoms that seem to be out of character for you. Pay attention to what others are saying and avoid being offended or dismissive to their observations and concerns. You might recognize you suffer from symptoms that need to be addressed. I will show you how to find what I call helpful others in my next video. Thanks for watching.